The pandemic is over, but for those with long COVID, the impact of the virus continues. And one of the nation's leading experts on this puzzling disease lives and works right here in San Antonio. That's Dr. Monica Verduzco-Gutierrez, professor and chair of the Department of Physical Medicine and Rehabilitation at the University of Texas Health Science Center in San Antonio, joining us live now to talk a little bit about this. So long COVID, still very new, but what have we found out about it?
So what we're finding out is that when patients have had COVID, or when people have had COVID, which now a lot of people have, unfortunately there's somewhere between, looking at the data, 5 to 10% of people who've had COVID or multiple COVID infections can have new diseases come up, new sequelae come up as an effect of having COVID-19. And we're starting to call that long COVID, or it's been known as that. And then these patients have new issues that have to be addressed.
And so the symptoms, it's a long list. I think I read it's over 200 different possible symptoms. If someone hasn't been feeling well for a while, is there anything in particular that should really make them stop and think, you know what, this could be long COVID, and then once they reach that point, where do they turn? What's next?
Right, because we don't have a magical diagnostic test to say you have long COVID. You kind of have to think about, did I have COVID? When was the infection? When did my symptoms start? Is it related to that? And then again, like you said, it can be 200 symptoms. It could be new disease states that happen after a COVID infection. But just really, if you're not feeling like yourself, if you're having more fatigue, more headaches, more issues with your heart, your lungs, your breathing, then please get to start at your primary care physician. Tell them of your concerns. Tell them how you've had an infection in the past. Tell them about what the new symptoms are, because we do know how to do symptom management, and we do know how to diagnose new conditions and treat those conditions that are treatable.
And UT Health has a long COVID clinic. You direct the clinic. What are some of the things that you'll do there?
So at our long COVID clinic, usually patients are referred in who have long COVID symptoms, and we do a holistic assessment. So we want to see what are the symptoms that they have. We have some treatments that can be offered, some referrals we send to other specialists where they might need multiple specialists. And sometimes we actually have multidisciplinary clinics where doctors come together and come up with a treatment plan for patients.
Okay. And you have also experienced long COVID. You helped come up with a definition for long COVID. And just in the past couple of days, you're also named to a federal advisory committee where people from outside the federal government are going to be helping Health and Human Services just kind of give them a little bit of guidance. What are some of the things you think you might be recommending?
So as far as, coming into this new federal advisory committee, which is just amazing to be able to represent. I'm the only person from Texas on the advisory committee, and it's a mix of people who either have lived experiences or who are clinicians or researchers or public health professionals. So I think we want to come in with an open mind and say, what has been done, what is already in federal agencies doing, and what is still needed, and then come up with a set of recommendations, hopefully to guide future research and future clinical trials for patients.
And if people want more information, where's a good place to turn?
For long COVID, there is, do a search, and there are lots of different resources. The American Academy of Physical Medicine and Rehab. We have multiple even papers for physicians who want to know how to treat patients who have long COVID. There are a lot of advocacy groups for long COVID patients that are created by long COVID patients that are out there that have wonderful information for people.
All right, well, we will stay in touch with you because we're just going to continue to learn more, but thank you so much for coming in today and filling us in on the latest on long COVID.
Thank you for having me.